Okay, so today I will introduce Mr. Respiratory to you. Okay, so we will introduce the respiratory system today. First of all, I will ask one question. Okay, so do you know the function of the respiratory system? Yes, main function is exchange the oxygen and carbon dioxide. As we know, metabolism in our body that's produce ATP and also produce carbon dioxide. So we need to inhale oxygen and get rid of the carbon dioxide. So that's we call the respiratory system function. Number 2, yes, larynx is the vocalization. So we can speak something and we can speak English. Okay, so many kinds of English. Okay, so respiratory system divide the tract and the lung. So respiratory tract, that's we have the nasal cavity and the pharynx, and the larynx and the trachea and the bronchi. So all that's we call the respiratory tract. And then we have the lung. Okay, so because they located in the thoracic cavity, so we also covered by pleural, so they form the pleural cavity. So number 1, so respiratory tract, they also divide two portions, and up portion and low portion. So upper respiratory tract, we have the nasal cavity and the pharynx and the larynx. Lower respiratory tract is the trachea, bronchi, and small bronchi in the lung. So that's what we call the bronchi trio. So one by one, number 1, the nasal cavity. So nasal cavity you already know. Okay, so look like my nose. Okay, so that's what we call the nose. So it's the external nose and internal nose, or nasal cavity. So this part is the cartilage, nasal cartilage. Remember the nasal bone? Yes, so they just very small formed the root of the nose. Okay, just the root of the nose, the nasal bone. The rest part, they are all cartilage. So we can do the plastic surgery. So implant maybe the cartilage from the costal cartilage and plant in. So make a nose beautiful. Okay. Then we have the proper nasal cavity and vestibular nasal cavity. Okay, so we divide two cavity. So anterior portion is the vestibular nasal cavity and posterior portion is the proper nasal cavity. So we talk about the cavity and look like this classroom. Okay, so we have the anterior wall, posterior wall, superior wall, inferior wall. Totally we have 6 wall. Okay, so the nasal cavity is the same. The superior wall. So the superior wall of the nasal cavity is the ethmoid bone. And the inferior nasal cavity is the maxillary bone. Palatine process. Anterior wall, yes, it's opening. Anterior wall is opening, and the posterior wall, choanine, yes, it's also opening. So choanine just open to the pharynx, so nasal pharynx. Lateral wall. So the lateral wall is the ethmoid bone. So they formed nasal conchae. Superior nasal conchae, middle nasal conchae, they all belong to the ethmoid bone. The inferior nasal conchae, just the separated bone, facial cranial bone. Medial wall. Medial wall is the nasal septum. So nasal septum, we have two portions. Okay, so superior, posterior is ethmoid bone. And inferior, posterior is vomer bone. Okay, two bone. Anterior, inferior, we have the cartilage. Okay, it's the nasal cartilage, so forming our nasal septum. The anterior, inferior portion, so that's what we call the litmus region. So it's very easy to bleeding. Capillaries is very enriched. Okay. Then the nasal cavity, they cover the mucus. Okay, they cover the mucus, so we can divide the two portions. So number 1, on the top ceiling and opposite to the superior nasal conch covered it, so that's we call the olfactory region, and the rest region, that's we call the respiratory region. So now I will introduce the paranasal sinus nearby the nasal cavity and empty full of the air and also open to the nasal cavity. So number one is a frontal sinus in the frontal bone, then the opening duct descending open to, so look at this picture, they open to the middle nasal meatus. We introduce the sphenoid sinus. So sphenoid sinus in the sphenoid bone body, so they just opening to the nearby rhesus, that's we call sphenoid ethmoid rhesus. It's belong to the superior nasal meatus. Maxillary. So maxillary body inside is also empty, full of the air. Then they also open to the middle nasal meatus. So very special thing is the maxillary sinus. The body maxillary sinus opening is the superior portion. So if infection inside, so the bacteria and the fluid couldn't come out. Okay, so last one, that's we call the ethmoid sinus. So ethmoid sinus, look at this picture. So we divide 3 groups. So anterior middle group just open to the middle nasal meatus, and posterior ethmoid sinus just open to nearby. Yes, it's by side of the superior middle nasal meatus. Okay, that's we call the superior nasal meatus. So that's totally we have the 4 pairs of the paranasal sinus. Okay, also you can look at this picture, okay, this specimen. So now the air coming in the nasal cavity and warm and humidify, then coming in the pharynx. We already introduced the pharynx before. Okay, so nasal pharynx, oral pharynx, and laryngeal pharynx. So be careful. Now the air or food need to make the decision. Why? Because the laryngeal pharynx, we have 2 openings descending. Anterior portion is the laryngeal cavity, and the posterior portion is the esophagus. I just tell you last time. So all this controlled by epiglottis.